right. Hello, everyone. It's Mayor Jane again. I know I've been on hiatus here, one or two things going on around the city, but we are back for our Facebook Live, and we have, please don't tell any of the other guests, but we have our absolute favorite guest here today, Dr. Charlie Lockwood. So we're going to talk a lot about COVID-19 and what's going on here in the city and get a lot of information, medical facts, and updates about that. So before I reintroduce Dr. Lockwood, I'll just give an update. So in Hillsborough County, we have 11,465 total positive cases in Hillsborough County and 140 deaths. That's two additional just today. In Florida, there's 158,997 total positive cases with 3,604 deaths. And as I have always said, those are numbers, but behind each one of those numbers is an individual, a human being that is someone's loved one. And so we're doing everything that we can to keep these cases to a minimum and thereby save lives, hopefully, in our city, in our county, and in our state as well. Testing, 124,611 people have been tested in Hillsborough County. Remember when we first started our Facebook Live, we were talking that we had tested around 1 or 2% of our entire community, and now we're up almost to 9%, which isn't a lot, but it's a big difference from 1. So that's good. Well, actually, the 8.6% is what is tested positive for COVID-19 in our community. So we've tested more than that total. So face coverings, we put, if any of you guys have watched the riveting emergency policy group meetings, we had a lot of talk 2 weeks ago about passing a mask order, and there was hesitancy on the part of the EPG to pass that, and we had really hit an incredible spike at that time. And so in the city of Tampa, we went ahead and passed a mask order, and that was on a Thursday. Then on that Friday, Saturday, Sunday, we gave free masks away, reusable masks, at a number of locations throughout the city. I believe 7 different locations, but we gave over 400,000 masks away to date. That's more people than we actually have living in the city of Tampa. And so great shout out to our code enforcement and our amazing Parks and Recreation team. They did a great job. I went out to Al Barnes Park and handed out masks on that Saturday, and there literally was a 3-block line of people trying to get in to wear the masks. So everybody understands the significance of it, and everywhere that I go, I've seen adherence to individuals wearing masks inside. You can look at the mask order on our website, but it's really very, very simple. People are making it much more difficult than it needs to be. If you're indoors and you can't separate 6-foot distance from each other, just put on a mask. It's not difficult. And there are exceptions baked into that order. So we have gone into the second phase of our Relief Now Rise Up Together grants. And we are passing a lot of those out to the community. I'm actually going to hand out some grant funding tomorrow in the form of $2,000 checks to our small businesses throughout the community. Remember, we were able to raise $8 million to provide relief to our residents and to our small businesses. All right, let's get to the exciting stuff. At USF Health, Dr. Lockwood leads the Mersani College of Medicine and the colleges of Nursing, Public Health, and Pharmacy, and the School of Physical Therapy and Rehabilitation Sciences. So clearly he is an underachiever. Dr. Lockwood is also a professor in the Medical School's Department of Obstetrics and Gynecology and holds a secondary appointment as a professor in the USF Health College of Public Health. He assumed all these leadership roles when he joined USF Health in May of 2014 and also has served as an executive vice president at Tampa General Hospital since 2015. He graduated magna cum laude from Brown University, receiving his medical degree from the University of Pennsylvania and a Master of Science degree in Healthcare Management from Harvard School of Public Health. So welcome, Dr. Lockwood, and thank you for all you do in our community, and mostly a personal thank you for being able to explain all of these incredibly difficult medical concepts and theories and terminologies in a language that I can actually understand. So thank you for that.
You're very kind, and thank you for all that you're doing. I think the reason I can explain things in simple ways is that I'm actually fairly simple-minded. And
No wonder we get along.
so, it's been a really interesting and sad and unfortunate month in June. We started off really in great shape, right? The virus had really been dropping throughout the month of May, viral spread. And over the course of the last, really since June 3rd, the state's seen a sevenfold increase in daily cases. It's almost unimaginable. And going from less than 1,000 to more than 6,000 a day over the last week. So it's a sevenfold increase in cases. But what's interesting, at least when you review the Department of Health numbers, there hasn't been a significant increase in hospitalizations across the state. Mm-hmm. Now, there's some dispute about those numbers, and I think they lag coming into Tallahassee a little bit. But the numbers across the month of June are only up about 20%. And in the last week, they're actually down 20% in the state. Now, it's a little different in Hillsborough County. So as of a rolling average of last week, we had about 144 hospitalizations per day in the state. The other weird thing is our number of deaths, the actual number of deaths per day, despite what you hear in the media, because I follow this every day and track it, has actually been dropping over the last couple of weeks. So we're down to about, terrible, each one of them is awful, but we're down to about 32 deaths per day. So when you look at the tremendous increases in cases and the slowing of the death rate, our case fatality rate for the state has dropped from about 5.5% of cases resulting in a death to 2.3%, which is actually one of the lowest of any state in the union. So that's kind of interesting in a kind of a macabre way, but it's certainly heading in the right direction from that standpoint. Testing, the state's now doing 40,000 tests. Remember when we talked about having to do 30,000? If we could do that, that would be just, right. The cat's meow, and we'd hit the Harvard Global Health Institute recommended 150 tests per 100,000 per day. Well, some days we're up to 50,000, but we've been averaging 40,000. The bad news is that we, for almost a month, had a test negative rate of 95%, and the floor dropped out over the last 2 weeks. So the average for the past week has been a test negative rate of 85%, so a test positive rate of 15% in the state and in Hillsborough County, and even in Tampa General and Baycare. I just talked to the Baycare folks as well. So that's a problem, because we had focused on actually going from 95% up to 98% negative tests as a sign that the epidemic was waning, and just the opposite happened. Yeah. The other amazing number is the average age of cases in the state, which when we started was 62.5, and now it's about 34. Mm-hmm. What that tells you is statewide, we got a lot of young people getting infected. Most of them are between the ages of 15 and 30, and most of them are getting infected by not wearing face coverings, not social distancing, and bars were a really, really big problem. And I give you kudos for being the first to implement the mandatory face mask, which will save many lives, because it saves lives, period, and discussion. But closing the bars was really important too. So bipartisan effort, all in the right direction with that. In the county,
before you leave that with the bars, that's something, a suggestion that I had made, because as you're aware that the county gets all of the CARES funding, was before, or when the governor was indicating he was going to open up bars, is why don't we provide support for those bar owners with that CARES funding? Because that was just disaster waiting to happen.
Correct.
And my heart goes out to all of those bar owners. But you're doing exactly what the indicators say is going to cause this virus to spread rapidly, bringing people in close contact where they're talking very loudly and indoors.
Well, since I paid for medical school by tending bar, I have sensitivity to that.
Yeah.
So yeah, we're going to have to figure this out because nationally we're going to have to close bars.
Mhm.
This is a major source of
Yeah.
infection, and I think we're going to have to limit gatherings to less than 10 again. But we have to figure out how to compensate these
Mhm.
bar owners, and figure out ways of avoiding lease payments and providing some
Yeah.
support for them,
Right.
and letting them pay back any debts they generate over a long period of time. I think it's a really important point, and one that probably nationally has to be solved as
Mhm.
well. So Hillsborough, even worse. We've had a 12-fold increase in cases since June 3rd. We've gone up to 650 cases per day over the last week. Um, Again, when you look at the Department of Health numbers, hospitalizations have actually dropped to
Yeah.
5 per day from 6 per day. Now, that's just not what we're seeing. Tampa General, Bay Care just went through the numbers with their CEOs today, have had about a threefold increase in admissions. So there's something wrong there. And I think it may just be the delay and hopefully in the Department of Health
Yeah.
getting those numbers. Um, Deaths have slightly, we had a very low death rate in Hillsborough, slightly increased to about 2.5, let's say 2 to 3 a day, from 1 to 2 a day. 70% of those are from nursing homes. So it's still predominantly very much older folks.
But isn't that trend changing? Because Dr. Holt said on one of the EPG meetings that the indication was turning towards individuals in that older category, um, catching the COVID-19 from other family members in the home
Yeah.
as opposed to long-term care.
So I think the most remarkable number for Hillsborough County is the average age of cases. So this is a rolling average, right? So we
Mm.
keep all the older numbers and we keep averaging them. We've gone from 48 in the end of May to 34 today. So most of the cases, the new cases that have been occurring over the last week have been in the 15 to 30 range. Now we're little tiny signal that maybe some older folks are getting infected right now. But right now, the vast majority of people being infected are young. And just talked to John Corus, almost all the folks that they've admitted over the last week are very young, young being 15 to 40.
And then
Um,
also, Doctor, haven't, because I just saw a email from Dr. Wilson, who works in the emergency room at
yeah,
TGH, and he indicated too that he didn't want that low admission rate to paint a false picture. He said because the people who are have it are so young that the presentations at the emergency department are way up, but they're actually treating and releasing 9 out of 10 of the patients.
correct. That's exactly right. So, and they're being followed actually by USF Health and our COVID-19 continuity clinic. And so we keep track of them. We call them every day. We make sure they're not getting sick, and sometimes readmit them. I think that so we have this huge increase, unbelievable 12-fold increase in cases, probably a twofold increase to threefold increase in hospitalizations, about a twofold increase in ICU admissions, although most of those patients are not ventilated. So the number of patients actually on mechanical ventilation has not increased dramatically. It's slightly up today at Tampa General, but it was pretty consistent through the whole month. So we're admitting more folks, younger folks. They're not quite as sick, and they don't seem to be requiring mechanical ventilation. Now, part of that is we learn how to treat them better. So we're keeping them prone on their bellies, and we're giving them high flow oxygen, and we've got a much better cocktail of medications to give them: dexamethasone, remdesivir, convalescent plasma. So we're doing a much better job of taking care of them when they do get to the ICU and they're that sick. But I think the moral of the story is that a lot of this current surge was a consequence of reopening, and particularly younger folks not socially distancing, not wearing face masks, not washing their hands, all the things I've been saying for 3 months, getting tired of saying it.
Uh-huh.
And so that's been, now there's been some older folks who, for various ideological and irrational anti-science reasons, have decided they don't believe in face masks. But I was very heartened to see Majority Leader McConnell, the Minority Leader in the Congress, McCarthy, Vice President Pence, all advocating mask wearing. So that's good. I mean, that's an important change. We just have to realize that this is all we got right now
Mm-hmm.
to be able to flatten the curve. And the data on masks is pretty solid. Now, the better the mask, the better the effect. So an N95,
Yeah.
the best, but surgical masks are second. And if you're going to wear a mask, try to have multiple plies, so multiple layers. But it reduces the risk of infection by 85%. There was just a Lancet article a couple of days ago that looked at all studies, 171 studies, and concluded there's about an 85% reduction in risk. Well, that's not bad.
Yeah.
So, ideally, social distance and masks.
Right.
You really want to reduce your risks. And I think that hopefully this is going to work, because if it doesn't, we're going to be in trouble. We're going to start to overwhelm our emergency rooms, and we're going to certainly start to overwhelm our hospitals. And as you know, I'm fairly non-emotional about these things and cut and dry and very data-driven. But now I'm saying, hey, this is a very, very serious moment. We have got to do these things. And if for folks that have kids at home, if you want your kids to go back to school, and I bet you do a lot, you better do this, because otherwise they're not going to reopen schools. So we're all very interested in flattening this curve for a variety of reasons.
Yes, without a doubt. So before we go any further, let's end. So we pretty much ended. We didn't end it, but we tried to. The mask debate. And people, I tell them, don't make it so difficult. It's not difficult. Just put on a mask. It's not hard. But talk one of the things quickly about the test to positive results. We have individuals in the country that are trying to say, of course, we have more cases, we've done more testing, but the proportionality of it, that, for the number of cases that the cases are rising proportionally.
Well, this is math.
Right.
It's really pretty simple.
Even I can do it. That's
right. If the virus were decreasing, or just staying the same, if there was no acceleration in spread, the test negative rate would actually go up. We should be today, if we really had contained the infection, it should be at 99%. It's at 85%. Now, there's really only one explanation that works mathematically, and that means we got a lot higher rate of infection. That's kind of remember back in third grade algebra, or whenever you take algebra, there's really only one solution to that formula. Yeah. So that's it. You can say whatever you want. It's spreading very quickly, and it's being spread by young people.
There you go. So let's talk about, you sort of hit on it earlier, about the surveillance system that's been put in place. You're talking about follow-up with individuals that have presented themselves at the emergency room, but talk a little bit about the surveillance system and then the contact tracing. And is it, at this point, the number of cases have exploded. So is there a point in the contact tracing at this time?
Well, certainly in parts of the state, the local health commissioners have said that they've lost control. It's going so much faster than they can possibly contact trace. That doesn't seem to be the case yet in Hillsborough. We do have a reserve army of contact tracers we can release if we have to. So, but the critical thing is that we got to keep being super aggressive about testing, because if we're missing 50% of the positives, well, we can't contact trace people if we don't know they're infected. So we got to keep testing going at a very high rate. I think the state taking over Raymond James, running it, I guess
5
Tuesday
days
through
a week.
Sunday,
Mm-hmm.
that's going to help a lot. We have exhausted USF Health folks volunteering for the county sites. I'm running out of volunteers. I've basically begged, pleaded, done
Moving
everything I can.
volunteers.
Gone out there myself. I've done 300 swabs, gagged a lot of people. But it's really important. And I know that Baycare has ramped up their testing. They're at an all-time high. TGH has ramped up their testing. They're at an all-time high. And Avancare has as well, HCA. So we just, I would like to see the regular old docs start to do testing. And they don't have to necessarily do it in their office if they, a lot of them complaining they don't have PPE correctly. They don't have enough in the individual physician offices. But they can write a prescription and they can send the patient to LabCorp Quest and they can be done there. So we all have to just be incredibly diligent about maintaining very high levels of testing, much higher than I thought we have to, much higher. But if we don't know you're positive, you can't be quarantined and you're going to infect folks. So, I think that's just another take-home point. It's the same message I've been giving you.
There you go, over and over, but nobody listened. It's almost like my kids. So I got a question for you on that too, because I've talked to several individuals that have tested positive and really had no symptoms at all. So is this a case of that the virus itself may be weakening and that individuals are asymptomatic, or is it just because they're young and healthy?
It's a really interesting question. There has been a recent mutation in the virus. It's called the D6146 mutation.
Oh, I'll remember that.
People taking notes. And what that little tiny mutation does is it makes the protein that binds to the cells, called the spike protein, makes it 8 times more common on the virus. So it's much more infectious. And we think that's one of the reasons young people that weren't getting infected before are now getting infected. Yeah, they don't wear masks. Yeah, they shouldn't be in bars. Yes, they're not socially distancing, but the virus is mutating in a way that seems to make it, I don't think it's less virulent. I just think it's infecting young people more and they do much better. And the younger you are, the better you do. So that all kind of makes sense.
All right. So now you indicated earlier, I thought that we were going to be able to put the mask order in place, continue with the mantra of 6 foot distance, washing your hands, taking all of those steps, and that we would be able to cut dramatically the transmission of it. Are you optimistic that that will work, or do you see, as you said earlier, that we may have to go to smaller group gatherings? Do you see us having to take other steps? And since we put that mask order in, how long is it before we actually see the effect of that?
So we should see it from your order. We should see an effect by July 3rd. And if we're seeing now a drop in cases in Hillsborough and the other counties and cities that have done it, then we should be okay with the bars staying closed, face masks, social distancing. If we don't, then I think I would urge the governor and others to kind of dial back to the earlier phase of reopening, phase 1 of reopening. Hope we don't have to do it. It's going to have a devastating effect on a lot of folks, particularly small businesses and restaurants, and the restaurants seem to be incredibly compliant, by the way. Every restaurant I'm in, they're following things to the T. You hate to punish them for that, but it is what it is, and we'll have to see. But my fingers are crossed that by July 3rd, we'll start to see an effect of these increased mask incentives that you all have put into place.
That will be wonderful. Now we're going into July 3rd, and there's another, besides the false information that masks don't play a positive role in reducing the number of cases. There's another position that it's individuals that are out demonstrating that are causing the spike in the cases, as opposed to bars and that closer indoor. So can you talk to us about the indoor outdoor
Yeah.
transmission of it?
Yeah. So outdoors is much safer than indoors because in indoors you just don't have ventilation. So the aerosolized virus stays in the air for a much longer time. Even if you open a door or a window, it's a little tough when it's 100 degrees out, you dramatically reduce the risk of infection. So outdoor, much better than indoors, much lower viral density. Remember, it's density, duration, and dose. The
Mhm.
denser the virus is in the air, the higher the dose in the air, the denser the gathering, and the longer you're in that group, the higher the risk. So I worry about the protest. I mean, everybody should exercise their First Amendment rights. It'd be great if they could do that with Microsoft Teams and Zoom. Um, but I do notice, and just having just watched a couple of the protests, a lot of young folks there wear masks, so that's good. They all should wear masks. They should all stay 6 foot apart. What is fascinating is, we talk a lot about disparities in healthcare, and African Americans, Black Americans just don't do as well in so many different parameters: premature birth, infant mortality, cardiac disease, cancer. Part of that's access. Part of that is other factors: poverty, stress, racism. Um, in Hillsborough County, the percent of cases among African Americans has dropped like a stone from 24% to 14%. Now, not all the protesters are Black, and there's probably equal numbers, but you'd expect, mathematics again here, you'd expect that if the protests were driving the infection, there would be a really dramatic increase in infections among Black folks in Hillsborough County. Just the opposite. It's dropping like a stone. Now, to all my African American friends, keep wearing face masks, socially distance, wash your hands, disinfect surfaces. But no, the protests have not accounted for this increase. It's
And
mostly white teenagers.
in addition to that, I've read the research that shows other states that have many more and much larger demonstrations than we have, and they haven't seen any surge in in the number of cases. So, this what we call after action reports. I don't know
Yeah,
what they're called in the medical field, but this is
same.
going to be phenomenal with what we learned from COVID-19. And one thing I need to bring up, I got late last night, I was going through my emails, and I received an email from someone, a young woman, that asked me to please try to reach out to the LGBT community. That in her world, that there had just been an incredible surge in the number of cases
Hmm.
in the LGBTQ community. So, for everybody, we need to make sure that we're doing uh, what it takes and taking those steps, because ultimately it could be an inconvenience for you personally if you're young and healthy, but it literally can be a death sentence, and it can be a death sentence for individuals that may not know they have comorbidities. I don't know the story behind two 17-year-olds who
Yeah.
died here in Florida, but how unhealthy can you be as a 17-year-old? So,
Well, and yeah, I know one of the cases did have a significant comorbidity, so I
okay.
suspect they both probably did. It just saw a picture, such a sad picture of a young woman who infected, I assume, her mother, and they're both they were both in the ICU at Tampa General. So
Mm,
yeah, really, I mean, you may feel invulnerable, but you may kill your parents. So
yeah,
please wear a mask.
exactly. Amen. All right. Well, anything else before we go to the questions? All right. All right. And we have, July 4th coming up as well. So everybody,
Stay home, watch Ozark, binge
there
watch
you go. Yeah.
Breaking Bad,
Yeah.
lots of stuff on TV.
Yeah, because you don't want, if you hear a knock on your door and it's either Mayor Castor or Dr. Lockwood, you're in trouble. So you better heed this warning. All right, let's go into questions. Let's see, I've got them right here. Okay, media question. This is from Haley Hines at Fox 13. Mayor Castor, 1 week into the county's mask mandate and almost 2 weeks into the city of Tampa's overall, are you seeing compliance? Yes. And how, and I must say that I went to lunch yesterday with an individual and she said, she goes, you have no idea how many people walk in and see you and yank their mask up. So we may go into the correct way to wear a mask, and that is not around your neck. That is actually covering your nose and your mouth, in case somebody missed that. I saw someone today that had their mask over backwards on their head with the straps around their ears. But when he walked in, he put it on correctly. So yes, that's doing well. And then how is code enforcement handling cases where people refuse? We've found very few cases where individuals refuse to wear a mask. And again, we're looking the same that we have been doing with all of the other regulations and restrictions, and that is through education, encouragement, and lastly, enforcement. So, it's a simple step to take, and you can save lives. So we've seen great compliance there, and we're very thankful for our code enforcement. Dr. Lockwood, last week at the Hillsborough EPG meeting, you noted that ER visits in the county for COVID-like illness have risen to about 460 a day. Is the number continuing to increase, decrease, or is it about the same? You talked about that, but what do you think moving forward? Do you have predictions?
Well, yeah, I don't have the most recent data from Hillsborough, but for the state, it's been increasing. So now that's a lagging indicator by a few days. So hopefully it looked like maybe it was starting to flatten a little bit. That may have been wishful thinking, but hopefully we'll know over the next 3 or 4 days.
Yeah,
July 3rd. We'll know by July 3rd.
There we go. We don't have much time. Okay, this is from Leslie Mays Forrester, and she's asking, and this, I think we can rephrase this question. As a health professional, what data-driven benchmarks would you like to see implemented in governmental decision making about rolling backward in reopening? Same question, but back into a full stay-at-home order. And then I want to add on to that. How do you feel about this data? Because for me, I've always used the phrase that it has to be timely, it has to be accurate and timely. And it's so difficult for us to get timely data in this COVID-19.
I think it's accurate, but maybe not as timely as it could be. I think that's why I kind of follow the rolling averages, and because eventually all the data does come into the Department of Health. It may be delayed. There are batches that are released by Quest and LabCorp. But if you follow it that way, it's the trends you're watching very, very carefully. Now, clearly, the original plan to flatten the curve was to prevent the hospitals from being overwhelmed. So for me, the critical indicator is we're running out of ICU beds, we're running out of ventilators, and we'll have to start rationing healthcare. And any early signs of that, and we don't have any right now, but any early signs of that, we got to dial back to phase 1, and or even stay at home. And so I don't think we're there. And I think I've been fairly moderate in my recommendations. No one's accused me of having my hair on fire. So but I am very concerned, and we're at a crisis point. And we can control this ourselves. If everybody's compliant, we can roll this back to where we were 3 weeks ago, and then we're going to have to think about maybe not reopening bars until we can achieve a vaccine. I mean, it's a tough call, and we need to compensate those businesses that are badly hurt by that,
without a doubt,
because they're doing it for the public health. It's not an economic force. I hope that answers the question.
Yes. Do you have any other?
No.
Okay, no other questions. So you made a statement earlier. You said, you're making rational decisions and you don't have your hair on fire, but I do recall one of our earlier ones when you did have your hair clipped by your wife with the dog shears. So that's as close as you get to having your hair on fire. All right. Thank you so much, Dr. Lockwood. This is
Thank you.
really, it's just so necessary to be able to get that information out there. You're a wealth of knowledge, and again, your ability to easily connect that with our citizens is much appreciated.
And
So
vice
thank you,
versa.
sir, and I will talk to you tomorrow. Take care.
All right.
Bye bye.
Bye-bye.